Hello, everyone. Welcome to today's Phlebotomy Webinar on challenging patient encounters. This is Sierra Tollefson, an education specialist for Mayo Clinic Laboratories. Our presenter today is Diane Hines. Diane is an outpatient lab service lead in laboratory services at Mayo Clinic in Rochester, Minnesota. Just a couple of things to remind everyone of before we begin today. There will be a question and answer session at the end of the program. You can submit questions online via the Q&A icon in Zoom. Please only use the chat function for any technical issues. Today's program is being recorded and will be posted to our website in a few weeks. And now I will turn things over to our presenter.
Thanks, Sierra, and welcome everyone. As Sierra said, my name is Diane Hines, and I've been employed at Mayo Clinic Rochester for 25 years in July. My position right now is a lead at the Mayo Southeast Family Medicine Clinic, and I've also worked inpatient, outpatient pediatric center, and I've been a part of our traveling care team. So today we'll be talking about safety, especially with challenging patients in various settings. So this is just a little bit of the outline, as you can see from the PowerPoint. I won't go over each of this slide, and we'll just go on to the next here for our objectives. And we're going to anticipate environmental and health issues that can lead to challenging patient behavior. We need to recognize when patient behavior should be reported and identify communication techniques to de-escalate stressful patient interactions. Here at Mayo, we have the rights for our employees to empower ourselves with our Mayo Code of Conduct that goes for patients and visitors. You can see this on our website if you click on the link below. I won't go over all of this with you, but just to let you know, we do have a code of conduct. So here at Mayo in 2022, we had about 9,189 instances of reported inappropriate patient and visitor communication towards staff. As you can see from this slide, there are 4 different types of workplace violence. While we are mostly going to talk about employee-patient violence, this violence can also occur in other ways. You can have criminal violence between employees, and violence from employees' personal relationships can also be brought into the clinic campuses and cause problems in the workplace. And so at Mayo, we have implemented the acronym SAFER. And this is to help us as employees deal with patients' misconduct and how we use this acronym to address their behavior. So the first one is step up. You got to step up and talk to the patient right away. You're going to address the specific behavior. You got to focus on respect for each other. And then you're going to explain the expectations and follow through. And you're going to report all the instances of misconduct to your supervisor. I have an example here of a patient that we had that came in with an inappropriate comment to one of my staff members. So he came up to one of my staff members from behind her and whispered in her ear, "How is my big, beautiful woman today?" And that caught us all off guard. And my first reaction was to say to him, "Did you really just say that?" But as you see from this acronym, you need to stay calm and address him in a respectful manner. So I just said to him, "Mr. Jones, that type of remark is inappropriate to say to one of our staff. Here at Mayo, we do ask that visitors and patients treat us with respect, just as you would expect us to treat you." So then I went on to tell him, in the future, these types of comments will not be tolerated. And if his behavior would continue, he will be asked to leave and he will have to seek care also. I then reported it on to my supervisor, who then turned it in and reported it to the provider. This was very hard at first. It's hard to address someone's behavior. And I will have to say I am from a generation where I grew up in the 60s and 70s, and at that time, people would just have said, well, that's just Mr. Jones. That's just him, you know. Well, after I addressed Mr. Jones, he kind of looked at me and was somewhat taken aback. And then he said he did apologize. And from now on, every time he comes in, the only thing he says to us is, "Good morning, ladies. How are you today?" So he realized his behavior here, and I hope that it has been better for him out in the when he's out doing personal things also. But it has become much easier to address these with this acronym, and it's been much easier to address since we've had COVID. I'm sure all of you have had a lot of conflict with having to wear masks and people's remarks too about that. And so this has really helped and made me feel a lot more comfortable in dealing with patients. So we also have this acronym ASAP, and that's approach with curiosity, share their concerns, and align with inclusivity and respect, and provide an option. So I also had a patient come in, and I have a tech that is from China, and she was not here this day. And he came in and he asked, where was his China doll? And that remark did take me aback. And so I just said to him, I approached, why would you, say that about our tech? And he says, well, that's what I like to call her. And I said, well, here at Mayo, we call her by her name, and I would appreciate it again if you do, when you come in, you address her that way. And he has since then, and he has never called her anything else, and has never referred to her when he has come in and when she's not here. So that, and again, it is hard. It's hard to address somebody. It makes everyone uncomfortable, but it's something that we need to do, and it helps, and it makes for a more workplace that everybody's more aware of how they need to address the patient, and more of us are starting to do that. So when you're in the hospital setting, we like to have preparation as prevention. We partner with the patient, and we do have some specific training for high-risk areas. Communication is so important with the RNs, or with any provider or care team person. When you go into the room, place your position in the room, know what's in that room, and then you need to leave nothing behind. But what I find, these patients, we are in there sometimes every hour, every 2 hours. They're not happy to see us. And so they are going to get agitated, and they are going to be challenging. And so you get to know those patients because sometimes they're in there for a little bit. So you try to find a common ground with them. Try to find something that you know that they like, that you can talk to them about, or talk to their caregiver that's in the room with them, and see how things are going. So we always go in and we introduce ourselves. We tell them what we're going to do. And every time we go into that room, we need to have them spell their first and last name and give us their birth date. After 30, 40 times of doing that, they get very agitated and say, you know who I am, you know my birthday, why do I have to continue to do this? And we just explain to them that it is our policy, and that they will be asked to do this every time. They then come back sometimes with, well, no one else, the nurses don't ask me that, or, no one else in my care team asks me that. And we then address the situation by saying, yes, we do know that, but when we are here, we need to make sure that we are getting the right blood samples so that you get the correct values, and specimens are collected correctly, and you get the correct results. I can give you an experience of where it was very to communicate with the RNs or the care team would have really been helpful. There was a patient that we had that had bad PTSD, and he would have explosive episodes, and that would trigger his anxiety. And the care team that was taking care of him that day knew about his episodes and what his triggers were, but they did not tell the care team that came in for the next shift. And he did become agitated, and he did become physically violent, where we had to call security, and the patient and the staff was in harm's way. If that would have been told to the care team that was taking care of him prior, then that situation would have never happened, and he would not have he felt so bad, and it was just a very bad situation for everyone. So it's very important to, when you're in the hospital setting, to make sure that everybody's on the same page, and to check with, if it is a new patient, check with the RN or check with the CNA and see if they have had any prior experience with this patient, that they could tell you, how to de-escalate if you're in a situation with them. You need to always keep yourself safe. That's the most important thing too. So now we're going to move on to outpatient settings, and this is where we'll talk about pediatrics and any family medicine, any just outpatient setting. So one of the challenges of outpatient setting is sometimes that the patient comes in, they thinking they're coming in just for a routine appointment, and then they unexpectedly find out that they have some life-altering diagnosis or information was given about their health that causes high emotions with patients, which it would cause all of us to have a bad emotion. And so as parents and caregivers, we can contribute to these challenging situations. I know when I was up on the peds floor, it was always very challenging, because at that time the patient would come directly from finding out that their child had cancer or some other, like I said, life-altering diagnosis. And then they came directly to our lab. And the emotions were high for everyone. The parents were upset, the children were upset. And at that time, you really have to have empathy to try to de-escalate what is happening. They're mad, they say things, and so if you instead of giving them sympathy, say empathetic things. Don't talk about "I understand." Say, "What can we do for you? How can we help you? This must be very challenging for you." So always address them, don't put yourself as I. I understand. I know what you're going through, because we don't, unless it has happened to you. Always use a calm voice when you're talking to a patient that is having high anxiety or is really challenging. Try to be calm. Use good body language, and let them have a little bit of control. Try to bring them back down. Don't ever say, "I need you to calm down now." If you say that, it's just like if you would say that to your children. Your children aren't coming down, they're not going to come down. So try to bring in, if your facility has a child life specialist, if you can bring in other team members that the child has with them, if there's other support that like a grandparent or someone that was waiting out in the waiting room. Use any type of distraction you can, but try to let the parent have some control of the situation, because they have just lost all control, and just heard devastating news, and this is the most precious thing that they have. And so when we have to remember that too, no matter what situation. If they're just here just for a lead test and they just had their shots, or they're still they're still upset because, their child's had some pain. So we got to make sure that we take care of some pain management. Offer sweeties, offer painies. We always use LMX up for our pediatric patients up on our Mayo 16, our specialty floor. But make sure that you have, all those things available for your patients. And with toddlers, I know parents, again, they're holding their child, and they don't want to hold them tight, or they don't want to do exactly what we're asking them to do. If we help them understand that we want this to be a positive experience for everyone, and we need them to help us to do that. We need them to help us make it positive. So if you can show them like comfort holds, or show them how you want them to hold. Ask them, if there's anything that they think might work for their child. Those are all good things to come in account. Ask them always, no matter what patient, if they have a preference, an arm preference. At that time, they will usually tell you what arm they prefer. And at that time, they will usually tell you if they would like another device other than a vacutainer. At that time here at Mayo, if a patient asks for a butterfly and they have a vein that is very prominent, we go ahead with their wishes. We use a butterfly. We do not go into a dissertation about why a vacutainer is better, because that can just escalate into a challenging situation. They want us to use what they think is best for them. So that's what we do. When you ask on our pediatric floor, we use mainly butterflies, or unless they are an older child, then we will use vacutainers. But for our I'd say from our 5 on down, it is always a butterfly. So now we're going to go into if anyone is like on a traveling care team, where you go to nursing homes and private homes. This can create a lot of challenges. You're out in the field. Here we use our bags, and we have all of our supplies, as you can see from the slide. Again, the prevention, preparation, so you need to make sure you have everything. This is where you can really partner with a patient. You walk into their home or the nursing home. They have things all around that you can look at, or not look at, but you can, if there's a picture, you can ask them about the picture. It kind of makes them more feel at ease, because we're in their private space. So we need to be respectful of their things and what they have. This is where family, pets, and caregivers can also contribute to challenging situations. A lot of people have pets, and we ask that the pets be put away. Some of us have been bitten by family pets, so that is why Mayo has taken the action to ask that they be put away. And that is when we go into a situation and there is a dog or even a cat out, and they don't want to put it away, we do really enforce and do, some of our safer acronym of we need this to be put away, because it's better for all of us. So when we're out in the field, this is where we see our patients that have many disabilities, our physical, mental, or medical challenges, and they can hold a whole different set of challenges. The most common one that we see out in the field is Alzheimer's patients. And why it's a condition that's difficult for the patient. It's also very difficult on the caregiver if we are seeing them on the home. They face emotional and physical challenges also. And they really sometimes get upset. Why are you here again? They don't understand. And we have to kind of de-escalate them more so than the patient. When we are doing an Alzheimer's patient or any patient that has any mental or physical disability and we need help, we always go to staff in the nursing home. If we need help out in the field, then we always ask that the provider or someone, the care team, will reach out to us and tell us that we need to have two people go, and then two techs will go out at the same time to the home or the nursing home and provide care for that patient. Um, with our Alzheimer's patients, we try to get into their reality mindset. We don't if we go in and they tell us, oh, my mom is coming to pick me up today and we're going out to lunch, we just roll with that. That kind of de-escalates them. We tell them what we are going to do. We always explain, no matter what patient it is, we always explain the procedure and why we are there. And then that helps us gauge what supplies and what device we will be using for that patient also. And then we also do give support to the caregiver. If they just seem to really be having a hard time, then we will sit and ask if they need any other support, if we can reach out to the provider and help them, ask them if they have any family that can help. That seems to help them. Again, it's empathy. You're asking them what they need. Always remember, it's so important to listen and validate any patient's frustration. If you really listen and validate their frustrations and they can see that, they do seem to come down. They seem to understand, okay, yes, that they're understanding right now I am upset and they are listening to my concerns. And they do seem to start to de-escalate and even really become part of the procedure. And then they usually always do thank us and say that they appreciate what we are doing for them. Also, when we are out in the field and we notice something with a patient, like their hygiene, our if the house is very messy and it doesn't seem that there's a lot of food, there's species, there's something that's unsafe for them in the home, we will contact the provider and then they will in turn turn it over to a social worker or to whoever they think needs to address that situation. An example that I have of when we have gone to a home, again, we had a 80-year-old male, and they called and said that he was very agitated, didn't like mayo, very combative, would strike his wife, would strike his daughter, which is very unsafe. So they asked that we go out and that we take two techs with us. So that is what we did. And when we got there, again, we introduced ourselves. Hello, I'm Diane. I'm from Mayo Clinic. I'm here to draw your blood. Well, that right away, Mayo Clinic, he was very, very upset. I don't like Mayo Clinic. And he started to go on, and then his wife she got upset. She's like, oh no, he's going to get upset and he's going to do something really bad. Well, we noticed that there was a bunch of orchids in the window, and right away we said, oh, what are those orchids over there? And started talking about his environment, what was around him. And he's like, oh yes, aren't those beautiful? And he started to come down, and we told him why we were there again, and he asked, oh, again, why are you here? And then we didn't bring mayo in. We just said that we were here to draw his blood. And then he started talking about all kinds of different things, and the situation really was de-escalated. In that situation, though, there were concerns about his wife also and the daughter, with him being abusive towards them. So we have found out since then that situation has also been taken care of. So now I guess we're on questions or concerns, or if anybody has any, like a scenario that they didn't know how to handle, or something that they would like to share. that I could maybe help you talk through it and see what your thoughts were and how we could maybe handle it together.
Thank you, Diane. Yeah, you can submit all of your questions or any scenarios that you'd like to submit through the Q&A icon in the bottom on the bottom of the screen there in Zoom, and Diane will address any that she can get to here. All right, one question just came in, Diane. Do you use any device such as Buzzy to distract patients?
Yes, we do have a Buzzy. We have a Buzzy, and we have it's like a light up fan that they like to use. We do give all of our children we have like ducks. We do have pop-up bracelets now. They all get something when the procedure is done. And we use we use Buzzy. Some adults ask for Buzzy. We do have adults that ask for painies. We have a lot of other distractions, a lot of like find the picture. If we do use child life specialists, they come in and, they find Waldo, or, they read. The parents sometimes, of course, will have something on their phone and the child will watch that on their phone. But yeah, we do have Buzzy.
Thank you. It looks like a couple more questions have come in. So the first one, for example, when the phlebotomist is taking a little longer to find a good vein and the patient gets agitated, what would be the best way to approach the patient?
Okay, when that does happen, here, if we are having a hard time, we do look at both arms. We look at their hands, and we explain to them, I know that this is taking maybe a little longer than you had expected, but we want to do this. We want you to have a positive experience, and we also only want to do this one time. So if you just give me a little bit of extra time to take a look, and then I will decide what I need to do, and hopefully we will get on and it will all go well. A lot of times they do know if they are a hard stick, but sometimes, of course, they're in a hurry or whatever. Our last time I was here, that person didn't have the problem. I've never had this problem. And again, you just try to explain to them, well, I'm doing the best job that I can do, and I just want to do this one time.
Perfect. The next question, what if you're dealing with agitated nurses and doctors? How do you try not to return that energy?
Excuse me. Yes, a lot of times they will come back or call or want to know where is my results? What is taking so long? Or why didn't you draw that? Or yeah, why wasn't it drawn on time? And at that time we address them, and it does get a little tricky because a lot of the times they have not put the order in correctly, so we don't have an order. And here at Mayo, we can never draw without an order. You just got to kind of say to them, and this is where safer comes in also. You can address, like I said, this can be worker on worker. It's just not a patient visitor, acronym that you can use. You can address anyone that is giving you a hard time. So one time I did have a problem with someone in what we call our central processing. That is where all of our samples go, and was being a little bit rude. Was being rude, and I just addressed it as saying, I know maybe that you're having, maybe this is a bad day, or things you wanted those results now, but you just cannot speak to me in that manner. And really, that is hard to say to a physician. It is. It's hard to say that to a provider or a nurse. And when you make them aware, like when I did speak to this person in CP, then they were like, oh, they did. A lot of times I don't even think they realized it's coming across. And once maybe you address how it's coming across, then they just seem to tend to be okay. But you have to address it. You have to, and that's hard.
All right, next question. We have a Buzzy, but do not know what Pain Ease or Alamax are. Are these things that are used outside of prescription or medication monitoring?
No. So Alamax is a tropical analgesic, and you put it on. It's a cream, and you have to. We do get that from our pharmacy, and you put it on the site. You put it on the patient's veins that you are going to use, and normally we put it on both arms, just in case. Once we do it, we decide to go to the other arm. And then you put a Tegaderm over it, and the patient with that does have to sit for 30 minutes, which is quite a long time, especially if you have a patient that's anxious, and especially children. Oh my gosh, I'm sitting here now, I'm going to sit here for another half hour, and they just think of, they don't know what's going to happen with the procedure and things. So now we're sitting another 30 minutes. Now with Pain Ease is just a cold spray. We called it a cold spray. And we just order it from our par stock, and you spray it on the patient's skin. It's like freezes it, and not long. You just spray 10 seconds, and it just kind of freezes the skin, and then you go in right after that and do the procedure. You don't let it sit. You are ready once you spray, then you are going to do the draw. And that is purchased anywhere. And it works very well. And that is one that we have used that a lot on older adults, our adults that have had cancer, multiple sticks. They request it. Our people that are very anxious, they want, we have older adults that nearly come out of the chair. They're wiggling, they're just very, very anxious. So when we use that, they seem to really calm down, and it's 10 seconds and it's done.
Thanks, Diane. One more question, it looks like. At our hospital, there is a patient relations team, which is a great resource. Do you have one at Mayo? If so, have you observed any instances where involving the PR team worsened the interaction?
I didn't hear the first part. I'm sorry, Sierra.
Oh, no, that's okay. Nope. At our hospital, there is a patient relations team, which is a great resource. Do you have one at Mayo?
Yes, we do. And we have comment cards that go to patient relations. And we always tell the patient, if they, sometimes they come back to us and they've had a bad experience at the desk, or they've had a bad experience with a provider. Are the bad experience with us? Or they've had a great experience. So in that case, yes, we give them the card, and we have them fill that out, and then we return it so that we know that it's returned. And yes, I have had a couple patients that were not happy with their care. And if you're not happy, then we need to address that, because we want you to have a positive experience. So whether it's good or bad, yes, it needs to be reported. So yes, we do. We have a patient relations, and we do use it.
Thank you, Diane. It looks like there are no further questions, so we will conclude today's session. Thank you to all of you that joined us today. If your question was not addressed during today's session, or if you have any additional questions, please include them in the evaluation. You may reference the link in the chat to access the evaluation beginning at 12 o'clock Central Time. Laboratory credit is extended for this program. Upon finalizing your evaluation, you will have the option to claim credit and print your certificate. If you had registered for this webinar and joined by phone only, please email us at mcleducation@mayo.edu if you do not receive the evaluation. As a reminder, this program was recorded and will be archived on our website in a few weeks. Thank you again for joining us today, and have a great day.